It was unclear to me originally that our experience was so much different from the rest of the world, and I was left puzzling for why nobody else was dealing with the issues of treatment the way we were. So I was pleased that the working group for treatment got put together to start looking at the evidence behind this. They've done a very thorough job, but I think that no amount of review of papers and discussion in conference room takes the place of actually getting out in the field and seeing what the patient experience is.
So one of the main reasons our group has come out here really is to hear firsthand from the people that have been suffering from this disease, and to really find out what we can do to help. There's so many unanswered questions when it comes to rat lungworm disease, and I think there's research work that needs to be done. So we're going to work with people here to try and design studies that will try and answer some of these questions that we have about rat lungworm disease, and hopefully make the outcomes better for patients in the future.
Dr. Ansdale actually took the initiative in wanting to come over here, and I jumped on that opportunity to get a educational session set to start looking at research and to get them set up with the support group. And I think that will put real human faces on the discussion we're having for treatment.
So my experience with this disease basically began this year, or past year, 2017, where we had a cluster of 4 cases that contracted rat lungworm on Maui. I was involved in the management of 2 of those cases, and since that time I've become increasingly interested in how the disease is manifesting in Hawaii, what we can learn about the disease, how we can have better outcomes in terms of treating people who become affected, or better ideas about preventing infection altogether. Basically, I think we're both windward communities, and so our environment is very much the same. I've worked with our farming community there. We've had infestations of the semi-slug, Parmarian. There seems to be a correlation between the behavior of the semi-slug. It's different than other snails and slugs that we see in agricultural communities. It will come up onto households, it will attack fruit that's on verandas, it will go up papaya trees. And so we're in the phase now of probably first year on Maui adjusting how we live. And I think that's what's required, is some behavioral adjustment to a new invasive species that unfortunately carries a possibility of a very severe and devastating illness long term for some individuals.
I think it's pretty obvious that compared to many countries in Southeast Asia, for example, it's a different disease that's being seen here, probably due to the level of infection that people are getting. But it's a different disease, so it's interesting to look at what's gone on, the treatment protocols, the diagnosis protocols that they use in Southeast Asia, but I think we have to develop our own, because it is a different disease that we're seeing here.
Because of your long history with this disease in Hilo, the potential to really be able to put this out in the literature and have people appreciate the fact that disease presentation, has been mentioned, is much different here than what people usually characterize angiostrongyliosis.
It's very striking that how severe the disease is here in Hilo. We also see severe cases on the other islands, and we're here to listen and learn and try to come up with collaborative research to try to not only treat and manage, but also prevent future infection. We're hoping to learn from the survivors their struggles with the disease. All of the victims of rat lungworm disease should have a neurological consult early, and it's looking like we should probably follow them over time to make sure that they're getting the proper treatment to manage their pain in particular.
What we really want is to try to develop some research so that we have some science in answering these questions of how to treat the disease, and not just give opinion based on our anecdotal experience, but really see if we can ask the right questions, design studies to answer the question more scientifically so that we can give the community, a modern, definitive answer. That's really what we're after.